Hi everyone, this is Renee. This is going to be the first voiceover for the chronic neuro content. For this voiceover, we're going to talk about chronic neuromusculoskeletal problems, and we are going to talk about dealing with a chronically ill child and the Glasgow Coma scale, along with some common diagnostic testing that you will also see with these problems. So some key concepts. When you see client teaching across the lifespan, what I really want you to think about with this is you're not just educating the client themselves. You're also going to educate the family. There's a lot of teaching that needs to be done for each of these problems. So while you're going through the voiceovers and the readings, really try to take out what the nurse will teach the client and the family members. Caring for families with a child with a chronic illness, this is very important, and I really want you guys to understand that in these situations, when you're dealing with a child and a problem like this, families are very involved, and they need to be cared for too, and the siblings. When discussing assessment and outcomes and interventions, I want you to think about what assessment findings you will see in these children with these problems, and how will these children present? What are some realistic outcomes for these children? And what are some interventions that we can implement to help meet these outcomes? When it comes to pre and post-op teaching, as you go through the readings, you're going to see that some of these problems will have surgical interventions, and I want you to understand the pre and post-op teaching. Mobility and assistive devices. Most of these clients will have alterations in mobility, so they're going to need adaptive devices, which also brings us to the next topic, interdisciplinary planning. So referrals for PT or social work or discharge planning. So keep in mind as you read the different referrals that could be made for these clients with these problems. For pharmacology, these are the 3 drugs that are on your objective sheet, and I want you to focus on these 3. These are baclofen, tegretol, and phenytoin. The medication PowerPoint for this content will also include all of these medications. Okay, so coping with these chronic illnesses, we'll start with independence versus dependence. Some of these children will be able to be, independent in some ways, and other ones are going to be very dependent on their family members and caretakers. Social isolation, we really want to make sure that the family or the child doesn't feel isolated in any way. When it comes to family, there's a lot of stress on the family dynamics here. Role changes. You could have children who step up and be partial caretakers. Economic pressures. Anybody with a child with a chronic illness, there's a lot of costs that are incurred. Many parents may not be able to work as they're staying home to care for their children, or they have to take them to appointments. The threat of death at an early age. This can be very scary for any, family member or parent that's caring for a chronically ill child. So we want to really make sure that we're being very therapeutic when communicating with these families. Family role strain on caregivers and siblings. This can be a major problem, and without community and social agency support, this can, put them at higher risk for ineffective coping. You could have siblings that are jealous because they aren't getting as much attention as the chronically ill child, or even parents that may feel upset because they aren't able to give all of their children equal attention, because the child that they have with a chronic illness is going to require more attention. Moving on to interventions for the chronically ill child. So what I want you to remember is the goal for any of these children with a chronic illness is to achieve and maintain the highest level of health and function possible. That is cognitively, emotionally, physically, and psychosocially. So we want these children to be the best they can be and function to their highest ability possible. So we as nurses want to help them achieve these goals by preventing medical crises, teaching the importance of controlling symptoms to the client and the family, carrying out prescribed regimens, whether that be referrals to physical therapy or other types of therapy, or medication regimens. We want to educate the clients and their families on the importance of taking their medications and keeping their appointments. Adjustment to changes in the course of the disease. Some of these diseases we're going to talk about in the next few voiceovers, they will change over time. Symptoms will change, and they are going to progress, and as the child gets older, the family grows with the child. They need to be able to adjust to each step of the way and understand what to expect, and that is where the role of the nurse comes in with health maintenance and promotion and preventing illness. Common diagnostic tests. So on this slide, I've included the common diagnostic tests for patients with chronic neurological or musculoskeletal problems. It's really important that as nurses, we understand the description and the definition of each test so that we can provide education to the client and the family members about what to expect. We need to know if there's any special nursing considerations, either pre-test or post-test. Like for a lumbar puncture, what is the position the patient needs to be in? Does the patient need to be NPO for these tests? Okay, the Glasgow Coma scale, it's also known as the GCS. This is a three-part assessment consisting of eye opening, verbal response, or motor response. Getting a baseline GCS, especially for motor ability, and then continuing your assessment so you can check for any changes. If the scores are declining, then that shows a decrease in functioning. So the GCS in your book is actually going to be focused more on adults, but it'll still give you a good idea of the three parts of the assessment. The one I included on the slide is actually different than the adult GCS, and this is adapted for a child or infant, and it's used to provide objective information about the child's consciousness. So I just wanted to show you on this slide so that you can see what a perfect score is for eyes, motor, and verbal, and what the numbers mean in regard to if they are minor, moderate, or a severe problem.